Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, I want to say thank you so much for your attention. And before I start my presentation today, I want to introduce myself. My name is Andi, Citra, Julianti, Amin. I am a medical student of Sultan Agung Islamic University. The rules of my presentation today is you can ask some question after my presentation is done. Are you agree? If you agree with that rule, let's begin the presentation. So my presentation today is about diabetes mellitus. For the structure of my presentation is I will start from the definition. After that, I will talk about the type of diabetes mellitus, how to diagnose, what is the goal of the treatment, and how the treatment of diabetes mellitus and the last is this summarized. I will start from the fact of diabetes mellitus. So the important thing you must to know in here is Indonesia is the fourth country which have the large number of diabetic patient after India, China, and United States. So Indonesian people must really aware about this disease. So, what is diabetes mellitus? Diabetes mellitus is a group of metabolic disease that is characterized by high level of glucose that is result from the fat in insulin secretion, insulin action, or maybe both of them. Next is the type of diabetes. So, there is three types of diabetes mellitus. That is type 1 diabetes mellitus, type 2 diabetes, and gestational diabetes. For the type 1 diabetes, that is happen in 10% of all diabetic patients. What is type 1 diabetes mellitus? Type 1 diabetes mellitus is the body not produce insulin, so there is a disruption on organ that produce insulin. Are this type can be prevented? The answer is no. For the type 2 diabetes is happen in maybe 90% of all diabetic patients are. And what is type 2 diabetes mellitus? That type 2 diabetes mellitus is the body produce insulin but is not used efficiently. So yeah, our body is still produce insulin, but that insulin didn't work in our body. Are this type can be prevented? The answer is yes. How to prevent this type is you can prevent it with health and balancing eating, appropriate body weight, and moderate physical exercise. So maybe you can walk 30 minutes in a day. And the last type is gestational disease. This type is happen in pregnant women. Now we'll talk about how to diagnose diabetes mellitus. There is 3 ways to diagnose diabetes mellitus. That is physical examination, symptom, and laboratory test. For laboratory test, we can check from our blood glucose level, and for the symptoms is maybe there is fatigue or not. And for the physical examination, maybe you can see there is cataract or not, or maybe there is an ulceration on their foot or not, or maybe are that patient are obesity or not. That all is characterized of diabetes mellitus. Now let's take a look for the complication of diabetes. The main complication of diabetes is neurovascular, that is disease on your nerve. And another complication of diabetes mellitus is microvascular complication and macrovascular complication. For microvascular complication, there is microangiopathy, retinopathy, and nephropathy. For retinopathy, that is an disorder on your retina, on your or maybe on your eyes. And for macrovascular complication, we can see in her there is atherosclerosis for the example. So what is the goal of the treatment? The goal of the treatment is relieve the symptom, improve their quality of life. So yeah, we hope that a diabetic patient can have an activity like normal people, right? So that is the second goal. And for the third goal is prevent the complication, and the last goal is correct the metabolic abnormality. I think the important thing of the goal of the treatment of diabetic patient is prevent the complication. Now, how the treatment of diabetes mellitus? The treatment is the first treatment is the diet and exercise. This treatment is for weight reduction, and the second treatment is patient education. The third treatment is blood glucose monitoring. So yeah, you must to always monitor your high level, your blood glucose level. And the last treatment is drug therapy. So maybe the last treatment is you can give drug therapy to the diabetic patient. The example is like insulin. Well, now it's bring us to the end of my presentation today. So I will summarize my presentation. So diabetes mellitus is a group of metabolic disease that can be happen in a level of age and can be causes many complications. With the strong possibility is death. So I really want that you really aware about this disease. So I hope that you can change your lifestyle from now, from bad lifestyle to healthy lifestyle for the best future. That's all from me. There is some question for me. If there is no question, I will close this presentation. I really happy for this opportunity that you give to me, and I'm sorry if there is some mistake on my presentation. Thank you so much for your attention, and wassalamualaikum warahmatullahi wabarakatuh.